Right now, over 30 million people in the United States have diabetes, and 1 in 4 don't even know they have it. Diabetes occurs when a person's blood glucose level becomes too high. There are 2 main types of diabetes. Type 1, where the body doesn't make enough insulin. This causes the body's blood sugar level to rise. In type 2 diabetes, the body's cells don't use insulin properly, causing a condition called insulin resistance. At first, the body reacts by making more insulin. Over time, the body can't keep up with the needs to produce enough insulin to control its blood sugar levels. Having too much glucose in your blood can cause health problems such as nerve damage, eye problems, kidney disease, and diabetic heart disease, or DHD. If you have diabetes, you can lower your risk of DHD by making lifestyle changes and taking prescribed medications, which can help you control your risk factors. Dr. Alvarez, cardiologist at Tri-County Heart Institute, explains how cardiologists treat their patients with diabetes.
Diabetes patients are considered from the perspective of a cardiologist as they already had coronary artery disease. That's how we see our diabetic patients. That's how aggressive we want to be with them when we have a diabetic patient. Because we know that diabetes is that single risk factor that puts you at very high risk for developing plaque in your arteries that can translate in a stroke, heart attack. So whenever we identify a patient with diabetes, we're going to treat them as aggressive as we would treat a patient that show up to the hospital with a heart attack. That is how serious diabetes is. It's a very complex disease. It makes the sugar stick around the proteins and the lining of the vessels, promoting inflammation. And then the inflammation promotes plaque formation, and the plaque formation causes a blockage in your arteries. Not only that, but we also know that patients with diabetes have higher chances of having high blood pressure and high cholesterol. So now we don't only have 1 risk factor for cardiovascular disease, now we have 3 risk factors for cardiovascular disease. My advice for patients with diabetes is know your hemoglobin A1C. Make sure that you and your doctors are very aggressive managing your sugar. Don't take your diabetes too soft. Be very strict, because this can be the beginning for a cascade of events that can translate in a heart attack. Your diet is very important. Your diet is very important. If you focus on a diet that is rich in vegetables and rich in unsaturated fat, you have a very good chance of reducing some of the inflammation that diabetes will cause in your system.
Join Dr. Alvarez every second Saturday of the month for Walk with a Doc. Participants will enjoy a brief presentation on an important health topic, followed by a walk at your own pace led by Dr. Alvarez. You'll find information on Walk with a Doc and the Tri-County Heart Institute when you click the Diabetic Heart Disease Story Link icon online at yourhometownhealth.com.